Hi there.
Hi, how are you?
I'm doing great. Thank you.
Sorry
You?
to keep you waiting.
No worries.
My followers are super into learning about this kind of stuff, and I hope to bring them, you know, just an honest conversation about it. So I hope that's what we can kind of have today.
Excellent. Excellent.
Yeah.
American Kratom Association, and I have worked in the policy arena on dietary supplements and natural products for decades. I got involved in politics as the campaign manager for Senator Orrin Hatch out of Utah when he first ran in 1976, which tells you how old I am. And then I came back and was the chief of staff of the Department of Health and Human Services during the Reagan administration. And
Wow.
there, a crash course in the way the FDA reacts to natural substances, plants, and vitamins. And when I left, I got involved in just in the government relations field and been lobbying on various issues, many of which impact the dietary supplement, the vitamin, and the natural plant field. So when in 2016, when the the DEA published their Federal Register notice scheduling the alcohols in kratom,
Right.
I received a call from the American Kratom Association asking if I could help. And at that time, I told them candidly, I said, "You have no chance of getting the DEA to withdraw the scheduling recommendation." And the reason I said that was that they used a very narrow section of the law, that's the emergency powers section. There's no review, there's no comment period, and technically no judicial review of it. Within 30 days, it becomes effective. And so I told them their chances of being successful were remote at best and non-existent, actually. But they could build a record that would be useful in a court action arguing a constitutional premise of abuse of agency discretion. But what happened after I joined the effort was amazing. In a 30-day period that would have otherwise been the effective scheduling of kratom, there were more than 6,000 people who directly contacted the DEA with phone
Wow.
calls and letters and emails. And that stunned the DEA because they really thought this was just another walk in the park, right?
No
They
brainer.
really didn't
Right.
know much, right? Didn't know much about kratom. At the same time, there were 140,000 people who signed a petition on the whitehouse.gov website. So you had this outcry that was from consumers that was really blowing everybody away on the policy arena. And then we managed to convince in a very short period of time 51 members of the Congress to sign a letter saying don't ban this. And there were 26 Republicans and 25 Democrats. So it was very balanced from a partisan standpoint.
Super.
The Congressman Mark Pocan from Wisconsin led the Democrat side, and you had then Congressman Matt Salmon, who currently is the chairman of the American Kratom Association since he left Congress, was the Republican that led that battle. And that letter shocked the DEA because now you had congressional people saying, that, this shouldn't be scheduled. And on the Senate side, we had Senator Orrin Hatch from Utah, who is arguably one of the most conservative members of the Senate. And then you had Bernie Sanders on the other, who we all know is the most liberal member of the US Senate.
Right.
And they both said, don't schedule this. So the
Wow.
DEA did this incredible thing. They withdrew the notice of intent on October the 13th of 2016. They told the FDA that they were going to open a public comment period, and that would be open until December 1st. And they asked the FDA to provide what is known as a full 8-factor analysis, which is the research document that's necessary to justify scheduling of any substance under regular rulemaking. And they gave the FDA until December 1st. So
Mhm.
two things happened in that interim period between October 13th and December 1st. One is an individual by the name of Dr. Jack Henningfield, who is a prominent substance abuse research scientist, world renowned, stepped forward and offered to do the 8-factor analysis because he had done dozens of them when he worked at the National Institutes on Drug Abuse. He said, I know exactly what has to be in that 8-factor analysis, and I will mirror what the FDA is going to do. So he undertook that project on a pro bono basis. Then in the comment period, there were 23,232 comments that were filed with the DEA. in their official record. And 99.1% of those were opposing the ban on kratom, the scheduling. And when you looked at those comments, it was just a wide spectrum of consumers, obviously, veterans, law enforcement personnel, medical professionals, and researchers, all saying this was not the appropriate way to deal with this substance. So December 1st comes, the FDA stayed silent. The DEA accepted the 8-factor analysis from Dr. Henningfield. They accepted the public comment. And it wasn't until a year later, more than a year later, on November the 17th of 1987, that the FDA finally submitted their 8-factor analysis. And typically, the DEA will take about 90 days to evaluate any recommendation for scheduling and then act. And obviously, if there is a public health threat, a safety threat to the American people, they'll act swiftly. So 90 days is kind of the outlier. They had the full dossier from the FDA claiming 44 deaths associated with kratom, which, by the way, is horrible. Anybody that dies from anything, you want to investigate and carefully evaluate it. But in the broad spectrum of statistical analysis, 44 deaths over a 6-year period globally doesn't move the needle on any statistical analysis. So that was a big issue.
When I was looking into the deaths, so I remember when all this was going on, I was super, I live in South Florida. There's a lot of kava bars down here, and great people go there, and a lot of them use kratom for a variety of different reasons. And like you said, there's medical professionals, police officers, like lawyers, just like a huge group of people that use this plant for either pain or, energy or whatever they want to use it for, right? I think it's important to give, a plant, it is powerful, right? Every plant like that has power, whether, and to know that, but they use it. And so I remember when this was all going on and everyone was like, oh my God, it's going to be illegal in 30 days. And then, okay, we made it this far. It's going to be illegal in this amount of days. And this is at the height of the opiate epidemic. Right. So I think that's why they wanted to really move on this, thinking it's a opioid-like plant. And but those deaths, when I looked into it, a large amount of them had happened in like Sweden, right?
Yeah, there were 9 deaths that occurred in 2009 in a 12-month period. So if you get a cluster of deaths in that short a period of time, derivative from one substance, which in this case was a powdered kratom product called Kratom, which was sold on the internet at the time. So that's going to get the attention of every public health official in the world, and it did. And some of them reacted by banning. Some European countries banned kratom. Here in the United States, because the FDA didn't have the authority, does not have the authority to schedule or ban any substance, they issued import alerts trying to literally put a tourniquet on the supply of raw materials coming in from Southeast Asia, where this plant grows. That didn't work very effectively. I mean, it obviously is a real problem, but it's not, it didn't stop it. And so that's a problem, but that's because the FDA's tools were limited. But what they told the DEA was that of the 44 deaths that they claimed were associated with kratom, 9 of those are in there. But what they didn't tell was that in 2012, so it would have been 4 years prior to their submitting their dossier, there was a peer-reviewed published article by Swedish researchers that looked at all 9 of those deaths. And they concluded that every single one of them was caused by an adulterant that was added to the kratom product, O-desmethyltramadol. And at that same dose level that was present in the kratom product that was ingested by those people who died, if you put that in a cup of coffee in the morning or a glass of orange juice, you'd be dead within minutes. Wow. So it wasn't kratom. And so we knew that the 9 deaths were bogus, and that was based on peer-reviewed published literature. So we FOIA'd, did a Freedom of Information Act request on all 44 of the deaths. And so the FDA had to cough them up, right? And they did give us 43 of them. The one that they said that they could not provide was based on a restriction that the family had placed on the release of the autopsy under the HIPAA regulations, which of course allows for the privacy of patients. And so we understood that we couldn't have that one, but we looked at all the other 43, and we had an independent forensics toxicologist evaluate those autopsy reports. Her conclusions were damning to the FDA. She said that all of those were either caused by an adulterant like O-desmethyltramadol and the 9 deaths in Sweden, and they were part of the 44, or by polydrug use, meaning that people were obviously suffering from some drug addictions or using in combination these substances. And that would, by the way, not be surprising that someone who has an opioid addiction problem might be using Kratom, because we know that people are saying that it helps them to wean off of those. So it's not surprising they might have it. And then the last category were underlying medical conditions that were not disclosed or evident at the time, and certainly would have been a contributing factor, if not the cause of the death of those individuals. So we published those results in a paper. The National Institutes on Drug Abuse looked at it, and they called us and asked for the details. Now, that's important because NIDA has a MOU, a Memorandum of Understanding with the FDA. They have the responsibility for evaluating the addiction liability of any substance, and they actually signed off on the original recommendation in 2016 for the scheduling of Kratom. So they wanted to look at the data. Wow. They did their own independent analysis, and they came to the very same conclusion that our independent researcher did. And so they published that. And of course, that freaked the FDA out. They, what are they doing? They're abandoning the cause. But more importantly, when you look at the 43 deaths, some of them are stunningly stretching the standard. I'll give you an example. One was a young man who had just been released from a mental health facility. He had bipolar disease that he suffered for his entire life, had multiple suicide attempts, was released from the mental institution. A week later, he hung himself. And when they did the autopsy, his tox screen showed that he had several illicit drugs in his system and also had drunk a Kratom tea at the proximate time of his suicide. He died from hanging. He didn't die from Kratom or the illicit drugs that were in his system, but yet because Kratom was present, they counted that as a Kratom death. That's not the standard we use. So when you look at the others, you see one example after another. There was not a single one that was Kratom only. And that's what Commissioner Gottlieb, who was then the commissioner of the FDA, tried to sell as the argument against Kratom. He said, oh, well, we have one that's Kratom only, which, as we learned, was outside of the 44. We FOIA'd that data. It took them a year before they finally admitted, well, we really don't have any evidence of that. But the one that they said was a HIPAA restriction, there was a reporter from the Huffington Post, a fellow named Nick Wing, who was doing an entirely different story at the FDA and found the fully unredacted copy of that autopsy on an FDA database, showing that it was not accurate that the family had put a HIPAA restriction on it. He FOIA'd it and got it, gave it to us. And you look at that autopsy, and this is why the FDA didn't want to disclose it. It wasn't because of HIPAA. It showed that the individual had, I think, 8 illicit drugs in his system, also had ingested Kratom, but he died of 2 gunshot wounds to the chest.
Are you
now, how in the world can you responsibly say that Kratom should be scheduled because you have people that are obviously suffering from mental health conditions unrelated to whatever drugs or Kratom that they may be ingesting, and then to have someone that's involved in a homicide and say that that's somehow Kratom related? But that shows you, I think it's a good illustration of how far the FDA is willing to go to stretch their case in order to justify what they do.
For this, like, what do you think, like, it had motivated them to be so gung-ho on the Kratom?
Well, that's of course the $64,000 question, but I have the answer.
Oh,
there has been a long-standing bias against any natural product, dietary supplement, or vitamin at the FDA. It came to a head in the early 90s when the FDA was making the recommendation that all dietary supplements and vitamins should be banned and forced to go through the new drug application process. Now, they knew that that was a non-starter because there's not a market for a dietary supplement product. It has a general, not a therapeutic effect, but a general health and well-being result. But no one's going to pay the money to go through that process of $3 to $5 billion in 10 years. They knew it was the death knell, and they kept promoting it. And there was an outcry at the time in 1993 and 1994, leading up to a congressional vote on legislation called the Dietary Supplement Health and Education Act. It's called the Deshay Act. And what that did is it significantly limited the FDA's authority in regulating dietary supplements and vitamins. And it's important to note that the FDA was partially right about what they were saying about dietary supplements and vitamins. They say they were killing people, just like they said about Kratom, right? But what they were talking about was poorly formulated or adulterated dietary supplement products, same as Kratom, right?
Yes.
But that has not deterred the FDA in any way. If it were up to them today, they would repeal Deshay and they would force all dietary supplements and vitamins into the new drug application process. That's the problem we've got. And by the way, since 1994, when Deshay was passed, the dietary supplement and vitamin industry has grown to a $53 billion a year industry, with more than 70% of Americans say that they regularly use dietary supplements and vitamins to maintain their health and well-being. The FDA hates it. They continue to hate any natural product. And a good illustration of the bias is found in the approach that the FDA currently uses on CBD products. Again, another product that they absolutely hate. Despite the passage of the Farm Bill in 2018, which descheduled any hemp CBD product derivative of hemp that had less than a 0.3% THC content, was descheduled. And the agreement that was reached by congressional negotiators with the FDA is that would clear the pathway for CBD products to be marketed in the United States, and the FDA was supposed to publish guidelines for that to happen. Since 2018, they not only have not published the regulations, they have openly demonized CBD and said that despite the fact that it's sold in all 50 states, it's illegal. And it was interesting, in February, the newly appointed FDA Commissioner, Stephen Hahn, spoke to the State Departments of Agriculture meeting in Washington, D.C., where they have their annual meeting. And he went off script on his remarks. Now, that's something the FDA commissioner is not supposed to do, right? And I'm sure he got his hand slapped when he got back to the agency. But it's on record with a video where he said that as he described getting off a plane at Reagan National Airport, walked down the concourse, came into the main terminal, and the first thing he saw was this huge display of CBD products, which are federally illegal there in the nation's capital being sold. And he said, it caused me to think, he said, the right approach for the FDA is not to ban CBD, but because he said it's a fool's errand, his word, a fool's errand to try to do that. So many people are using it. He said, why would we do that? Let's make sure that they're manufactured properly. Right. Let's inform consumers about what benefits there are or are not, and let's let them make an intelligent decision. That's exactly what we want to do for Kratom. And the interesting thing is that in 2016, based on the data that we received from the exporters in Indonesia, the Ministry of Agriculture there, I attended a symposium in the growing region in Pontianak, Indonesia in 2017, and they said that there were, at the time, enough Kratom raw materials being shipped into the United States that would sustain a user population of somewhere between 3 and 5 million people. Wow. Since 2016, the exports have now grown to where it's over 4,000 metric tons a month of Kratom raw materials coming into the United States, which sustains a consumer population of 10 to 15 million consumers. So the perverse.
That's how many consumers of Kratom there are in the United States?
Yes, and it's growing exponentially. So a perverse outcome of the FDA's attack and war on Kratom has been to draw attention to it so that more and more Americans are learning about it, they're trying it, and they're seeing that it has benefits for them for their health and well-being. Now, there have been consumer surveys, principally led by Dr. Oliver Grunman from University of Florida, that looked at the consumer population and profiled the average Kratom consumer, and they found about a third of the 15 million estimated Kratom consumers in the United States use it like you would a cup of coffee in the morning for the pick-me-up, the energy boost, and increased focus. About a third of them use it because it has these benefits for smoothing out your mood, and maybe even some, taking care of some of the anxiety issues that people sometimes suffer from. The last third use it as a way to address acute and chronic pain issues. And so it has analgesic effects. There's no question about that. And so people found that not only is it effective as a replacement for these kinds of pain issues, but they also discovered that it helped to moderate the withdrawal symptoms as they replaced opioids with kratom. And so that was a fascinating kind of conclusion. And it was interesting because the National Institutes on Drug Abuse, as a part of their examining their support for the original claim by the FDA that this should be scheduled, they did their own independent animal studies. They did two. They ran them concurrently, but they wanted to get an answer as to whether or not they should have endorsed the recommendation in the first place. Those two studies were published within a couple of weeks of one another in 2018. One's called the Himbi Study. That was an independent, federally funded study done with a group of researchers outside of NIDA. And they came back and they said that based on the animal studies, that they observed that there was no addiction liability at all to kratom. That's important because that's one of the criteria for scheduling under the Controlled Substances Act. But they said there was also the observation that the test animals actually reduced their cravings for the reference drug, which was morphine. So it showed that their argument was we need to do a lot more research on this because we're seeing the very thing that people are reporting that they're experiencing in the use of kratom. So that was absolutely fabulous. 2 weeks later, an intramural study at NIDA using test animals, the same animal study, came back with exactly the same conclusion. Now, they said there's not a significant addiction liability. In the science world, sometimes they play a little bit of a difference in the wording, but the same conclusion, it's not schedulable under the criteria of the Controlled Substances Act. They use methamphetamines as their reference drug. They saw the same reduction in cravings. Wow. So today, NIDA has over $15 million in studies that are out in the field right now looking at kratom and its potential therapeutic benefits in the opioid crisis. So Johns Hopkins University released a study that they did earlier this year, in January 2020, and they looked at adult kratom consumers who are using kratom as a treatment for pain.
Harm reduction,
And harm reduction, a treatment for pain, or are using it as a way to wean off of opioid addiction. Mm-hmm. And they found that 87% reported that they had a significant decrease in withdrawal symptoms from using kratom. Right. And 35% were completely opioid-free within a year. Wow. Now, if we're talking about searching for an alternative to highly addictive and potentially deadly opioids, why wouldn't we embrace kratom rather than try to demonize it the way the FDA has done? So that's a big problem.
So, talking about if you use, kratom, as you know, is in the same family as the coffee tree, right? Coffee plant. And either of those things, if you use them every day, you're going to feel some sort of withdrawal because your body is used to it, right? And the same is for kratom. I don't think it's obviously as severe as all the opiates that are available. Any opiate right now, kratom has less severe withdrawals if you take it every single day for a year and then stop, right? For me personally, I was in the hospital a year and a half ago, and I didn't have coffee for 3 days. I had a massive headache, right? And while I was in there, I used kratom. I denied the pain medication that they wanted to give me morphine, and I used a small amount of kratom for the 2 days I was there, and then I got rid of the rest of it. I have not used it since. I think it's important to use it, for me, medically, right? I don't want to... Sure. That's just how I see it. Because I do think it's a powerful plant, and any powerful plant can have some sort of side effects. So people in recovery, right? I think if they aren't taught how to use a plant like kratom, they can use it to a point where maybe it's unhealthy. What do you think?
Well, and it's a great point. What I cannot tell you, even though there's no evidence yet been documented that someone has died of a kratom overdose, I can't tell you that that's not possible. We know that a person...
but maybe the withdrawals are similar to that of...
Right. So the same thing is true is I cannot say with certainty that you cannot be addicted to kratom, even though the scientific reports that have been done show that you develop a dependence rather than a traditional addiction, right?
Right.
Because we don't know yet. There needs to be more research done on this. But the point you made is the critical one, and that is a person who becomes a long-term user of Kratom is going to develop a dependency on it, and they are going to have some form of withdrawal. My vice is, and I don't have one with me, my vice is Diet Coke. You know, in the same way that you experienced the withdrawal from coffee, I would have the same thing from Diet Coke.
Right.
But a study that was done by Dr. Grunman looking at the withdrawal symptoms from Kratom and analyzing them as in contrasted to opioids, he said that you would have a similar withdrawal pattern for coffee or caffeine, which if you stop cold, you might have a headache, you might have an upset stomach, and the gastrointestinal discomfort for about a week at the most. Now, that's not the profile of an opioid, right? And then you look at Dr. Henningfield's research that's peer-reviewed and published, which looked at the relative risks of the use of Kratom to manage acute and chronic pain as opposed to opioids, and what's your overdose risk. And he found that your relative risk of overdosing on Kratom versus opioids is 1,000 times greater for opioids than it would ever be for Kratom.
1,000%.
So, yeah, so you said it right. It's harm reduction. If we're going to look for some kind of solution to what is a public health crisis of enormous magnitude, and but for COVID would be the #1 health crisis that remains in the United States, then we ought to be finding ways. And that's exactly what the director of the National Institutes on Drug Abuse, Nora Volkow, said in her testimony under oath before the U.S. House Appropriations Committee when asked directly, should Kratom be scheduled? And she said no. First off, it'll turn off the research that we critically need to evaluate the potential value of this plant. Secondly, she said, we are getting these powerful testimonials of people who are saying that it's helping them. She said, why? Why would we stop that? Because they're seeing benefits from using it, and the alternatives are horrendous. And so that led to the Congress putting into report language in the FY 2020 appropriations bill saying that Kratom shouldn't be scheduled. There should be expanded scientific research and even human clinical trials. And that language is also in the FY 2021 appropriations bill, when and if they ever get through the Senate, which hopefully will be soon. But that's something that we're looking at. We're trying to work hard to educate the Congress. It is unexplainable from a public health standpoint why the FDA is on their war on Kratom. It makes no sense.
Crazy.
And we've adopted the model that medical marijuana followed, which is to start to go to the states and replace the regulatory scheme that the federal government should be imposing, which in this case, the FDA, and we're asking the states to assume that role to protect consumers. So we had the Kratom Consumer Protection Act passed in Utah, Georgia, Arizona, and Nevada. And in this current year, legislative session, we were scheduled to have at least 24 more states that would have passed it, except for COVID interrupting the sessions. We're now geared up and ready to go, and we're hoping more than 20 states in the the 2021 legislative session will pass the Kratom Consumer Protection Act, because what it does is it says you cannot adulterate the Kratom product. You cannot tinker or synthesize.
A extract? Is that what it says?
It's the natural Kratom plant. You can't tinker with the alkaloid content of the plant. You can't change it or alter it. You can have extract products, but you have to maintain the same proportion of the alkaloids that are present in the natural plant, because nature got it right. And we don't want people messing with that.
And I think the extract is where more of the people have more issues when it comes to the extract portion of Kratom. If we're talking about, any sort of dependency or whatever, I think it could come in with the extracts, right? And not with the plant itself.
Possible, but I think it speaks more to the behavior of people, and extracts are more powerful. And so they're more suspect in terms of a person who has an addictive personality that gets into those issues. So yes, I think that's a problem. But these bills say you have to follow good manufacturing standards. You have to label them properly. And most of the states say that you can't sell them to minors. So that's what the FDA should be doing. And they refuse to do it because they're hell-bent to expand their regulatory power. So we're looking forward to the 2021 legislative sessions, because we're going to serve notice on the FDA that they're wrong, and the states are going to fill that gap.
When it comes to purchasing Kratom responsibly, I think it's important to buy, if people are going to try Kratom or whatever, to buy it from people who are sourcing their Kratom responsibly and that they know what they're getting. I know online right now, the Kratom, sellers are having a hard time with their merchants and stuff like that. I didn't know if you had any advice on to people if they're looking to buy, good Kratom that they can feel comfortable trying, where that would be or how they would find it responsibly.
So the bottom line to that is that, and I hear a lot of people say, well, where do I buy it? And there's criticism about buying it in gas stations or convenience stores or on the internet. So the American Kratom Association did a couple of things. One, that we imposed or offered to vendors to go through an independent third-party audit of their manufacturing facilities and testing procedures to make sure that it's pure Kratom. And so there are a list of vendors who have passed that criteria available on the American Kratom Association website. We think that's an important resource for consumers. Consumers also should go to the various chat boards on Reddit, and we have our own forum at the American Kratom Association, listen to recommendations of fellow consumers, ferret out the vendors that are trying to hustle you on the Kratom products, and listen to people, because right now, until it's properly regulated, there is a potential for you're getting bad Kratom products. There was a study done in Chicago where the researchers went out and purchased commercially available Kratom products from a variety of different vendors, and they tested them, and they found that a couple of them had some issues with heavy metal contamination using the FDA standard. Now, it wasn't that it was dangerous at normal consumption levels, but potentially could be if someone's taking a lot of Kratom, which, by the way, is self-limiting. Dr. McCurdy, one of the leading scientists, said the thing about Kratom is it tastes terrible. And so but even if you use a capsule form of it, that it's self-limiting. It's like a governor on a gas engine. It can't go any faster. So you're not going to get, if you're using pure Kratom, you will not get a euphoric reinforcing high like you do with drugs. It just won't happen. You're not going to get the kind of long-term powerful effect that you see with opioids. But the alkaloids in the Kratom plant do hit the mu opioid receptor in the brain, and they have what's called a partial agonist effect, which means that they do provide some pain relief. It's moderate, but it allows you to manage your pain, right? It's not going to wipe it out entirely. It's non-addictive, and most importantly, it doesn't travel to the respiratory system of your brain. And that's where the danger comes.
Part of the plant. It's interesting to know that something can hit an opioid receptor in your brain, but also not affect your respiratory system, which is, if anyone doesn't know is watching this, is how people overdose, right? Their respiratory system slow down to the point where they are not breathing anymore. So
if you listen to former Commissioner Scott Gottlieb, he stood before the American people in a press conference and he said, oh, Kratom is bad because it hits the mu opioid receptor in the brain. It was silliness. It was malpractice in terms of science. He knew it, by the way, but of course they're so hell-bent to get the Kratom banned, they were going to do it. Scientists ridiculed him over it and said, "Yeah, this is nonsense. How can you say such a thing?" But they have their agenda, so they're going to try to promote it. But the bottom line is there are many common products that we use every day that hit that same mu opioid receptor. The question is, what impacts do they have on the other sectors of the brain and your neurological system, and what pharmacologic effect do they have? Chocolate hits the mu opioid receptor. Cheese does, which accounts for why cheese is such a popular additive. It gives you pleasure, right? When you eat a pizza with cheese topping or you have it on a sandwich. Lots of reasons why people consume those kinds of products. But when you get into the field of those products like Kratom that have this kind of pharmacologic effect, we obviously ought to be careful. But if we prove, and we have, that it doesn't have the dangerous impacts that opioids do, we should be rushing to find ways to appropriately regulate it and make it available to consumers rather than try to ban it. And that's where the FDA is.
Are there any states right now where Kratom is illegal in the United States?
Unfortunately, there are. In the period between 2012, when the FDA imposed their import ban, and 2016, when they promoted the scheduling of Kratom, they filled the information pipeline to every public health official, law enforcement official, pharmacy board in the United States, and 6 states got suckered into the deal to say, let's ban it. Now, the good news is that in the state of Wisconsin, as an example, the 6 states are Wisconsin, Vermont, Rhode Island, Indiana, Arkansas, and Alabama. In Wisconsin, in the February, the Senate Health Committee unanimously passed what they call opening a bill file to replace the ban on kratom with the Kratom Consumer Protection Act to appropriately regulate it. Because of COVID, it didn't get acted on, but that was a good step. In Rhode Island, the Commissioner of Public Health, the Director of Public Health, opened up a formal review of the ban process. We have the KCPA filed in both houses in the legislature, so I think we're going to make great progress there. In Vermont, there was a bill filed by Representative Sina that was a part of a deregulation of a number of drug substances, and kratom was deregulated. Now, that bill didn't pass because of COVID, but when I spoke with him, he said, the more I've learned about kratom, I need to do a freestanding bill because we want to do the KCPA. So we think we're going to be successful in removing that ban. Where Arkansas wasn't in session. They have their legislative session goes every other year. So we're looking forward to engaging that battle there. Alabama's a tough state for us. We got lumped in with a bunch of the spice and synthetics down there, and kratom was added to that list. We're going to work on that one, but I'm not as optimistic about as some of the other states that currently have banned it. But we're going to reduce that number banned. But all of that, every one of those states got suckered by the FDA with bad information, with absolute distorted and lies in many cases about the effects of this plant. And so we're dissembling that. We're correcting the record, and we're moving forward with what we think are very positive results.
It's interesting how in a couple years where this has all happened, they can ban kratom, yet in Washington, for instance, legalize hard drugs, and
Right.
in other states legalize mushrooms, and yet there's still this war on kratom. So I have one more question for you, and this is a conspiracy theory I have, so I don't know if you'll indulge me. But,
I will.
So we know that kratom can help when it comes to withdrawal symptoms from regular opiates. I know that Scripps Laboratory, for instance, has been doing some research into kratom. And I have this thing that maybe they want to make kratom illegal, or maybe they will when they have learned to make some sort of medication out of it, since many of our medications are derived from plants, that can help, drug users get off their, instead of Suboxone, which, obviously is a difficult medication to get off of long term. If you are on methadone, you cannot switch to Suboxone. To get methadone users onto Suboxone, kratom would be a tool, right? So I'm thinking of all the tools that this could be used for in the addiction treatment industry. Do you think that they would, ban kratom to make a medicine out of it, or no?
Well, it's not such a far-fetched conspiracy theory. I think that there is a future for a kratom derivative, synthesized version of the alkaloids that will be effective. And I think that will be the outcome of the research that's being done by Dr. McCurdy under the National Institutes on Drug Abuse grant. Now, that should not impact the availability of kratom to the average consumer. But here's the problem. You look at what happened with opioids. Excuse me. We had a robust opioid market, far too robust than it should have been, right. Facilitated in large part by the FDA, by the way. They were empowering these pill mills to actually develop and work. So that was a problem. But I think that today, excuse me, today we're looking at the opportunity to take this miracle plant and synthesize it into a potential drug, but the plant needs to remain legal today.
Mm-hmm. Very cool. Thank you so much for doing this with me. I super appreciate it. Is there anything else you would like to say to totally
thank you
about kratom or anything like that? I think we went over a lot of things.
Excuse me. Actually, no. Thank you for this opportunity.
Yeah, for sure. Would you mind if I email you after this about some of the things we talked about? There seems to be all this research out there that I don't see when I Google things, and I would love to be able to put that out there for people to see. So maybe you could email me some of it.